My name is Lisa Goss, and I'm going to be talking about melanoma, which is skin cancer. Melanoma, also called malignant melanoma, means black tumor and begins in cells called melanocytes. They produce the dark protective pigment called melanin, which is what gives us our skin pigment. Melanocytes also form moles where melanoma often develops. There are three categories of melanoma. The first one being cutaneous melanoma, which is just the most common one, skin cancer. Um, the second one, mucosal melanoma, which occurs in any mucous membrane like the throat or your mouth. And lastly, ocular melanoma, which is a rare form that occurs in your eye. The signs and symptoms include any changes to the skin, especially a new growth or a sore or anything abnormal, a sore, bump, or a rash that doesn't immediately heal. It can appear scaly as well, or like raised bumps. Anyhow, the American Academy for Dermatology came up with the easy way for early detections using a ABCDE model, which just stands for the A for asymmetry, which is the shape, B for border, which describes the edges of the mole or the sore. The C is for color, meaning is it brown, black, red, white. The D is for diameter, which is the size of the mole. And lastly, E for evolving, which is how the mole or sore changes over time, especially in its size. The main cause of skin cancer is exposure to the sun, especially once you get a sunburn and start to peel. Researchers believe that UV rays from sun damage over their lead to skin cancer. They over time they damage your skin and it can lead to skin cancer. Besides that, it can develop from family genes, weakened immune systems, and from using tanning beds, tanning salons. Like any other cancers, melanoma develops in 5 stages. Really, it's 4, but they're using a 0 stage, so they're doing stage 0, 1, 2, 3, 4. So in total, that's really 5. So for the 0 stage, melanoma cells stay on top of the skin and they don't spread anywhere. Stage 1 means the cancer is less than 1 millimeter deep without any sign of ulceration. Stage 2 cells have grown 1 to 2 millimeters deep and the tumor appears ulcerated. Stage 3 cancer can be any size, but by stage 3, the cancer has spread to the lymph nodes. Stage 4 spreads beyond the skin and the lymph nodes. It can spread most commonly to the lungs, sometimes the brain and the liver. Everyone's complications are different depending on what stage you're in and what treatments that the doctor tells you that you may need. But typically it's just scarring from the excision or surgery if you may. Physical pain, of course. And then I guess you can also get depression and anxiety. So, melanoma cancer is always diagnosed after a proper biopsy of the suspicious area of the skin. The procedure they use is called a punch biopsy. The doctor will also review your family history and check any moles you may have. The doctor, most commonly, they can just look at the skin or mole. They can see if it's abnormal. In one of my slides, I know there was a huge one on his back. So, of course, that's cancerous, I would say. As far as treatment goes, the first step is to remove the melanoma, which can be done as an outpatient procedure by doing an incision. Depending on what stage you're in, they may also do radiation therapy, chemotherapy, and antiviral drugs. Melanoma can be cured if it is found eh, and examined in the early stages, just like any other cancer. But that's about it. I think I gave you some pretty good pictures of the different types of cancers of the skin, and I know there was some pictures of moles on there. So I hope you enjoyed the video, and I look forward to the feedback. Thank you.